Good afternoon. I'm John Guest, Managing Director of the Northern Ohio Office of Philanthropy, Ohio. I'm honored to welcome you to this afternoon's program, Philanthropy, Ohio, Uniting Communities Through Change. We are excited to welcome nearly 700 registrants from Greater Cleveland and beyond. Funders, nonprofits, government officials, donors, students, media, from all walks of life. Opening this week of Conversations of Consequence. Philanthropy Ohio is honored to partner with the Cleveland Foundation to present the virtual panel discussion, which officially kicks off Cleveland Foundation Annual Meeting Week, presented by KeyBank. Philanthropy Ohio, the statewide membership association that leads and equips Ohio philanthropy to be effective, powerful change agents in our communities, is excited to partner with Cleveland Foundation to present this virtual panel, which again kicks off the Cleveland Foundation Annual Meeting Week. The theme of the week is 2020 Community Vision, which is especially timely as we begin a new decade with a series of seminal experiences that have and will continue to change the way we view the world around us. From a global pandemic to a national reckoning on systematic racism and a series of natural disasters that have all devastated communities across our country, we will need a clear and inclusive vision in order to rebuild and move forward. Philanthropy has a vital role in crisis response and recovery, and that's what we're here to discuss today. Our panelists have experience helping to lead their communities through defining moments of change, and we are grateful that they've joined us today to share their perspectives and learnings with all of you. Dale Anglin, Program Director for Youth, Health, and Human Services at the Cleveland Foundation, has been working around the clock with funders across Greater Cleveland to mobilize emergency resources in support for frontline nonprofit organizations during the COVID-19 crisis. Chanda Smith-Baker, Senior Vice President of Impact at the Minneapolis Foundation, has helped to lead her foundation's response to the death of George Floyd in the custody of the Minneapolis Police Department and the historic civil rights movement sparked by his killing, his murder. And Mike Parks, President of the Dayton Foundation, brings his perspective, having responded to both a deadly tornado outbreak and a high-profile mass shooting in his community within a span of a few months last year, a natural disaster, domestic terrorism, and now a pandemic. Today's conversation among these community foundation leaders will be moderated by Philanthropy Ohio's President and CEO, Deborah Aubert Thomas. We hope all of you in the audience will lend your voice to this conversation as well. We will have an opportunity to field your questions through the Q&A function later in the program. And now, with that, I will hand it over to Deborah to begin this important conversation. Deborah.
Thank you, John. Dale, Mike, and Chanda, welcome. Each of your organizations has responded to unprecedented needs. We all want to hear about your response and also how each of your community foundations approach creating and designing a vision for this year and beyond. So Dale, I'll start with you. So a few of us could truly anticipate how COVID-19 would unfold in our communities. Can you walk us through the response in Cleveland in those initial weeks and months to follow, and how did partners come together, and what was the call to action that helped build the coalition?
Thank you, Deborah. Thanks for having me on this show. We all understood the gravity of the situation when Governor DeWine closed the schools on March 13th in Ohio. That's when it really hit us. For funders, it was clear that this crisis was unlike any we had seen in our lifetimes. The Cleveland Foundation had created special funds for crises in the past, like the Puerto Rico hurricanes, so we quickly realized we needed to do the same. But we also realized we would need partners to raise the amount of funds needed to support our nonprofit sector during this unprecedented crisis. Luckily, due to several other issue areas that funders have been working on together in Cleveland, including our Say Yes to Education initiative, our Let's Safe Home initiative over the past few years, it was easy to reach back out to our fellow funders to say, will you join us in this effort? We got advice. We checked in with the Seattle Community Foundation, as they were one of the first areas to get hit with the virus, and they had started a fund a few weeks before ours. Within a few days, and that's days, not weeks, we had raised almost $4 million. created a process for grant making, and agreed that we had to streamline and shorten any application and reporting process for those grants. We knew money had to get out the door very quickly. We also agreed that first and foremost, at that point, we had to help flatten the curve. So we used the latest public health research and science as we made our grant decisions. And we knew basic needs had to come first. So food, housing, PPE, a term I didn't even know on March 13th, and information became our primary grant-making areas. We ended up doing weekly and then bi-weekly grant-making for 4 months. In the end, we had over 80 grant-making partners with us, plus over 2,000 individuals who donated. Believe me, I've been in philanthropy now for almost 15 years. This is the fastest I've ever seen local philanthropy work, but it was important and the right way to help. I also want to acknowledge that most grantees only see or know the program team of any foundation. So the program team, for example, the Cleveland Foundation. But to raise this much money and to get it distributed so fast took the work of many of our foundations, grants administrators, finance staff, communications, and advancement staffs, all working overtime to make this work as fast as it did. They are some of the unsung heroes of this work. Thank you, Deborah.
No, thank you, Dale. That's an amazing response. Chanda, I wanted to acknowledge that there was yet another act of violence last week with the shooting of Jacob Blake. Can you take us back to the events of May 25th and the weeks that followed? How did your foundation react? And then also, how did you bring your own lived experience to help inform your work?
Yeah, thank you so much for the invitation to be with you today. You know, I'm coming to you from Minneapolis, where the work feels very heavy, as I'm sure it does in many of your cities. The protests that have spurred across the country and across the globe in response to George Floyd, we certainly feel the impact of the moment. And the moment, I think, necessitates us all to think differently about our work, our leadership, the way that we need to evolve our work. And so we have had those talks internally. I'm going to start a little bit with my lived experience in that I am 3 years into philanthropy formally. I led a nonprofit previously. And so we would have in that work a number of people that would come in and talk about their interactions with policing. And I was very involved with the Police Activities League and other things, working with our police chiefs. As we have encountered this with Philando Castile and others, Jamar Clark, where we had an occupy of the police precinct. And so we have had this disruption happen prior to George Floyd, but there is a moment that we are living in. And I think there's both the murder of George Floyd and what happened in that incident in that moment. And then there was the aftermath and the rioting and the protesting that has happened since then. And so, and then you mentioned Jacob Blake, where that did not happen in Minneapolis, but we certainly felt the impact of that. But what did happen following that was a man who committed suicide in our downtown, and where the community, it had been rumored that it was a police-involved incident, and the community began to loot and protest in our downtown Minneapolis last week. And so we are living this in real time. What I will say about the foundation is that we certainly would have leaned into these issues previously, because if they are impacting our community, we would have been in them. What I can say, though, that has evolved is how we do that. And I think Dale indicated the ability to move everyone forward so we can have a quicker response. We were able to eliminate some of the bureaucracy in our application process to make it easy. In the aftermath and the rebuild and the cleanup, we were able to get grants out the door in about 48 hours, get a grant application and get money out the door within 3 weeks. And so we're really quite proud of that. And we also recognize that being responsive is in fact important, but it's also important for us to position for long-term strategies that address the issues that we're faced with in policing. The last thing I guess I'll add, and I'm sure we'll get into this, is that our city council also came out very boldly after the George Floyd murder, saying that they were going to defund or divest in policing, and that's another conversation that we have going. And then I guess the final point would be is that I'm a mom of 4 sons and a daughter. And so there is no experience more contextual than that, what that means in living and parenting through that experience. So thank you again for the invitation.
Thank you. And thank you for sharing from both your professional and your personal experience. Mike, I wanted to turn over to you, and it's been just over a year since the Dayton community was impacted by first a violent tornado outbreak, followed a few months later by the high-profile mass shooting in the Oregon District. Can you walk us through that experience from your perspective as president of the Dayton Foundation?
Thanks, Deborah, and thanks to the Cleveland Community Foundation and to Philanthropy Ohio to join you today. I appreciate that opportunity. So you had, within a year, 15 tornadoes last Memorial Day that ripped through Dayton, very much in a disproportionate area of our county that's low income, touched on multiple jurisdictions. A little over 2 months later, 9 people's lives were taken, another 30 plus were injured in a mass shooting in the Oregon District, which is a social area of our downtown. And as that was wrapping up, obviously, the pandemic that all of us are dealing with. And as I reflect back on those 3, Deborah, I think what I notice is the role the foundation had to play was different in each of those 3. And in the case of the tornadoes, I mean, obviously we weren't involved in the immediate recovery. There's people like the Red Cross that are built for that. That's what they're here for. They did an outstanding job. But we really needed to be the convener and the organizer, not only the collector of the funds, but how are we going to go about thinking about the individual recovery as well as the longer term community recovery. So our role there was more organizer. And it's not about us, we're not leading it, but we had to pull the folks together that were going to work on that. And there's an unbelievable public-private partnership of over 16 nonprofits, our city, our county, that have been working together wonderfully on that. And then along comes the shootings, and again, we're the collector of funds, but it was much more than that. And there we had to lead. And we had to try to figure out how in the heck do you get private philanthropic dollars to individuals, which is kind of the #1 cardinal sin in our world, right? How you can't give money to individuals. How in the heck do you do that? How do you do it legally and appropriately? And then last, on the COVID, what was our role there, and trying to figure that out. And there I'd say the Community Foundation was more of a team player. So in the first, we had to organize. The second, we had to lead. The third, we had to be a good team member. And as I reflect back on that, the relationship capital that the Community Foundation has was everything. And, when the time came when you needed to pull people together, quickly, in a very flexible way, and everybody's trying to not trip over each other, that relationship capital and investing the time up front in that relationship capital came back to be very, very helpful. And having those relationships, having invested the time prior to those events when you really needed it and you had to react, was very helpful. So, in a crazy way, as I think back about the last year, our staff and our board feels thankful. And that seems kind of crazy in light of everything that's happened. But I think we're thankful that the foundation was here. And I think any community foundation in Ohio would have done the exact same thing. And I think that's why we're built this way. We had to find out where the gaps were. We had to figure out what our role was and say, how can we help you help others? And so in a crazy way, we feel thankful.
And thank you, Mike. And, a lot that you've had to respond to in just, a year's time. So from where you stand now and you reflect on that response in the past and how you shifted gears, or how did you shift gears from the crisis mode to thinking about sustained recovery over time? How are you managing sort of the overlapping of all of the current crises as they continue, and how they'll intersect with long-term impact?
Yeah, great. Let's set the mass shooting aside for a second, because that has long-term impacts on the community. The foundation's role really will wrap up this fall. And not that there aren't continued efforts that go on in the community, but that's kind of ramping down. But as you think about tornadoes, we'll divide that into two sections: individual recovery of individuals and families, and then longer-term community recovery. Community recovery would be how do you rebuild neighborhoods, green spaces? What's the policy around abandoned buildings and infrastructure? That individual recovery, we played the role as the fiscal agent, convening not only public entities, but 16 unbelievably great partners in the nonprofit sector that have really been handling that individual recovery. And that's got about another year to run. And so making sure that that group was together was part of our role, serving as the fiscal agent, but just unbelievable partners came to the table to help, each bring in their own resources and their expertise. That'll wrap up in about a year. The longer term recovery, the county, the city, ourselves, others, worked on who's going to own this long-term recovery. The Community Foundation's here to help. We're trying to figure out what the gaps are, but we're not a recovery agency. And so what's the role, who's going to own that long-term? And we were able to get our Regional Planning Commission on board. They didn't even hesitate, jumped right in. And then our role was to help recruit and convene a long-term recovery board along with MVRPC and the county and the city and others. So there's now a group of 16 very committed people that are going to manage the long-term recovery for our community. And again, our role there was to help convene, and we were happy we were in a position to be able to help. The second thing I think as we look at long-term recovery is we've pivoted our discretionary grant making for this year 100% away from a responsive grant making to focus on follow-up and longer-term issues related to tornadoes, related to COVID, and related to race relations. And so we paused our discretionary grant making. 100% of our grants are going to go to those three areas and more strategic, longer-term issues that we have as a community. So those are probably two of the longer-term issues, I think, Deborah, that come out of that.
Great, thank you. Chanda, you mentioned the attention of not just the murder of George Floyd, but Philando Castile before that, and the other incidents of last week. All eyes of the world have been on Minneapolis, and I'm wondering, with that kind of scrutiny, was there ever pressure, whether it was from the staff, the board, donors, or the community, for the Minneapolis Foundation to respond or not respond in a certain way? And how do you balance the need to take a bold stand in a politically divisive climate when there can be pressure to avoid the political fray or of rocking the boat? So particularly being a community foundation or a public charity, how did you find that balance?
Yeah, so yes, we got pushback and response from all of those constituents and stakeholders, and I think that should be expected. Our foundation had been undergoing strategic planning that was looking at what does it mean for us to lead? How do we bring all of our work together in terms of research, leadership? Where are we putting a stake in the ground, not just supporting other organizations and nonprofits to do their work, but what does our leadership voice look like? And so we were examining that as a foundation. We had came out with a convening and podcast series that I lead called Conversations with Chanda that was very much about how do we as a foundation begin to look at sort of the grittier issues, the things that we're not talking about outside of our communities of comfort. How do we have donors that are talking about race that are largely white. We have leaders that are talking about it that don't think philanthropy is supporting what they're seeing on the ground. We have community members that are not trusting of our institutions, which can sometimes be directed at us. And so what is our responsibility to lift that up, to position ourselves more as a listener and a responder and an amplifier of community voice? So we were going down that journey. And what I will share is what we have had to wrestle with. So I think we have had staff that are younger, typically, or folks of color within philanthropy that are saying, you're not doing enough. We're not doing enough. Are we responding? Are we being listened to? What about issues that we're facing as staff inside of the foundation, how are we going to respond to that? How, we've got inequities we need to deal with in our sector. So how can we take a solid stance there? So we have been certainly responding there with some of the conversations that we've had around equity and positions that we're taking, particularly around defunding the police or abolitionists that have come to us. We have board and donors that have varying opinions along that continuum between like reform to like complete abolishing of the police department. We have colleagues that have been working alongside of us that have been working around equity, but frankly, their eyes have just opened up to really what the inequities are. So that's both a painful experience and an opportunity for us to move forward. And so it has been challenging. What I would say to you is that the foundation was already exercising what does it look like to be bolder. We were already taking steps. My first two conversations in our live events were, decolonizing wealth and white fragility. We have done further work around white supremacist organizations and other things that I think even a couple of years ago would have been harder to swallow and we would have been more afraid. But we've been going down this path over the last year. And so I think that we are an embodiment of the tensions that exist within community, and we're staying in it. That we see our role as not necessarily taking a position, but as convening those with positions and points of view and how we can bring that together. We've been in the criminal justice work, and I think we'll talk about that a little bit later, but it has been a challenging time. And I want to say, too, that we are a staff of people doing this from our homes, trying to parent, trying to do another thing. So I think the convergence of many things with the constant sort of bombardment of trauma or things that are traumatizing that are happening in our collective community is something that we have to be mindful of in our approach, our actions, in the way that we deliver our work.
Thank you. Dale, I'm thinking about the partnership. You had more than 80 different partners come together across sectors in less than 4 months, and you raised more than $8.6 million, a truly unprecedented collaboration. What were some of the unexpected lessons learned from the new partners? How is this collaboration continuing? And also, how are you planning for a sustained funding and support strategy into the future?
Thank you, Deborah. We learned a lot. First of all, we got to know each other, I think, way better than we ever had before. And one thing is we learned to rely on each other's expertise. To be frank, funders aren't always in the room together with each other, sharing what they know. We do it periodically. And our funding partners support a wide range of issues and groups. Some did not support the small groups, for example, or the behavioral health groups, for example. But we learned that different groups have different expertise. So our United Way, which I learned, had an incredible expertise when it came to housing and basic needs. We would talk to the county on a regular basis. They were one of our funding partners to see what was going on in their world and what we needed to know. It was wonderful, to be frank, to see who had what expertise in which area, who knew certain grantees. We checked egos at the door, and we worked and we learned together. And by the way, we're planning on doing that going forward because we liked it so much. We also learned that we needed to fund the hubs and the spokes. So an example is, yes, of course, we needed to fund the food bank, and that was probably one of our first grants. But in many neighborhoods, because we listened to people on the ground, we learned that residents could not get to the food bank. All of our people don't have cars. They don't even trust the food bank. What they relied on and trusted were their local neighborhood nonprofits, some very tiny, but many of whom pivoted to food during the pandemic. So we decided to fund both of those, the food bank and those small hubs, those small spokes. They were all equally important to making sure that people had access to quality food. And we learned, importantly, some of us already knew this, but I would say others of us learned it even more, is how important policy and advocacy is to helping the most number of people possible. Remember, philanthropy is often about scale. We try to help as many people as possible. In this time of huge, urgent need, to be frank, philanthropic dollars were a drop in the ocean when compared to available federal and state dollars for for COVID response. While we were grateful for the tremendously generous community response that allowed us to deploy several $1 million for just emergency food relief, advocacy from the Center for Community Solutions and others led to the governor supporting an application to the federal government for pandemic food stamps. That brought in over $30 million to get food to over 100,000 children in Greater Cleveland. That is real policy and advocacy work and trying to get to scale. We also learned how to fill in gaps. There were times when, like I said, that word PPE that I did not know anything before March 13th. We ended up funding a couple of PPE coordinators who we are funding to this day to help get PPE out to the community in ways that was hard to do. And unfortunately for everybody, our pandemic is not over. So we took some time this summer to evaluate the work of the fund. We had great consultants help us do that. We heard and we listened and we heard that we can see that the need is still great. So as of today, actually officially tomorrow, we're announcing a phase 2 of the fund. And if you want to learn more about phase 2, we ask you to tune in at 12:30 tomorrow to our TCF official annual meeting at 12:30 where you'll get more details. But everybody agreed we want to do this again. We need to do it again. We want to work together and we want to work in even a deeper way to continue this work.
That's awesome. I'm excited to hear about phase 2 of that. So if you think about also the murder of Ahmaud Arbery, Breonna Taylor, and George Floyd and others, you know, the renewed attention that has brought to the devastating and foundational reality of systemic racism in America. How did that, or how will that going forward with your partners address the intersections of racism and public health in the response to come?
Yeah, so, you know, it became very clear pretty early on that the coronavirus pandemic was not society's great equalizer, right? It really was a mirror. It held up to us and laid bare historical and systemic racism that has resulted in disparate health and economic outcomes throughout our whole region. So when we talked to the community and the stakeholders this summer about how philanthropy could continue to help, without us even asking the question directly, they all expressed very loud and clear, from a community resident up to very high-level stakeholders, that racial justice was interrelated to the public health and the economic crisis. And they specifically asked philanthropy, especially working together, to apply a racial justice lens to help disrupt and dismantle all of these different unjust policies and practices that have negatively impacted people of color, many of whom have been disproportionately impacted by COVID. So we know that our fund alone cannot undo this long history. We understand that. But in phase 2, we're actually adding on a component. We're adding on a long-term recovery component that will look at ways so that we can work together across our various foundation missions and focus areas to address racial justice issues. We're just beginning to think through what that work looked like, so more to come in the future. But it was very clear when we asked about COVID that racial justice is what came up. And so we can't address one without trying to address the other.
Thank you. Thank you. Chanda, you mentioned earlier a little bit about your work promoting criminal justice reform, and you've been doing that for a number of years. How have the events of the summer impacted your existing approach?
I mean, it certainly has intensified it. It has really, I think, involved our board and our staff and our donors in a way that maybe they hadn't been tuned into that work, because it's really an unavoidable conversation right now. Race is an unavoidable conversation. And as Dale pointed out, that with COVID, what it did is it revealed the disparities that we've been working about in a more immediate way. Like, we were able to see who the frontline workers were, who were being impacted. We were able to see who was getting tested, who was dying from it, the organizations that were getting support. And so I would say the same thing is true with criminal justice reform and police community interactions, where the community has been talking about this for quite a long time, but now we're in this fight with community in this battle towards equity and justice in a way that we hadn't been before. And so I think how our work previously, and I mentioned earlier that I'd been in philanthropy at the foundation formally for almost 3 years, or 3 years this week actually, It was, as RT Ryback, my CEO, will say, is that, me coming to the foundation, was kind of conditional on my ability to work in criminal justice reform, because it's something that I'm deeply passionate about. And so we had been building relationships, and in that work, we had an established advisory committee helping us with our Fund for Safe Communities, which was about community level violence and systems change in policing and criminal justice. We have criminal justice reform baked into our strategic framework. And so we were going down this track. And I think that what it's done is allowed for us to have trust built and relationship built, so that we didn't have time spent trying to create new tables, that we had some trusted allies to call and get as part of the response. I think it also has attracted new partnerships into the work. So we have an established partnership, for instance, with the Timberwolves and the Minnesota Lynx, where those sports organizations want to get more intimately involved. And so we're advising in both ways. And so I would say that both the pressure is on, because we've been in it, for us to lead. And we had trust established, what allowed us to move quickly. This is, again, something that we're responding to in real time, and we're completely clear that we'll take long-term commitment to actually get us to where we need to go for our communities related to improved interactions and justice should another situation occur.
Great, thank you for sharing that. And then a final question before we take some of the questions that are beginning to populate the Q&A or the chat function. Mike, we can expect that natural disasters like the tornadoes you experience may become more common, and with severe climate change. What advice would you have for other community foundations that may well find themselves in the path of destruction? Are there proactive steps that they could take now to prepare?
Each situation is a little different, but I'll give the example of what the Cleveland Foundation did last fall after the shootings in Dayton. Michael and Ron, the staff, reached out and they asked just that question, Deborah. They said, what do we need to be doing now to think about should this happen in Cleveland? And I think that's the right thing to do. You're not going to have every I dotted, every T crossed, but what are those big picture things? And I think if you could have a 1-pager or a 2-pager that you keep in your file, that God forbid, if this happens in your community, you can pull it out. And the things to think about there is just to give you an example, it's both operational and it's public interfacing. So as an example, in a given year, the Dayton Foundation probably deals with about 150 press issues or press requests or placements or whatever. In a span of 60 days, we had 2,000 press requests for tornado-related things, and we had over 4,000 from all around the world related to the mass shootings. So we go from 150 in a given year to 6,000 in 60 days. Like, how in the heck do you gear up to handle that? Who are the resources that you might be able to turn to? I mean, we were digging everywhere to try to find people to help. And the same thing on the operational side. In a given year, we normally take in about 8,000 donations to all the different funds at the foundation. We had 8,000 donations in 60 days. Like, how do you just physically do all that? And luckily, there was companies and others in Dayton. They literally gave us their employees and said, you've got these people 24/7 for the next 6 weeks, and it was a godsend. So thinking through what are legal issues, how do you get HPR help, how do you get processing help, and just you don't have to get it all set up, but just having some pre-conversation about that, I think would be helpful. Just have a 1-pager that you could pull out. Again, God forbid you need that. And lastly, I think just know you're not alone. The morning of the shootings, we had no clue what to do, right? We had zero idea. We didn't know how to get money to individuals. We started to reach out to folks, and within minutes, my phone was ringing. I was getting texts. I was getting emails from people, community foundations around the country that had experienced other mass shootings. And they said, we know you don't know what to do, but we're here to help you and we'll stand with you. And I think that when I alluded earlier that in a crazy way we're thankful that we have institutions like community foundations. That's what they're built for. They're built for just these circumstances, and to know you're part of a network and part of a family that's there to help you personally, as the CEO, it was everything to me. I was very appreciative of that.
Thank you. Thank you, Mike. John, are there questions coming in that you'd like to pose to the panel?
Yes, and we have about 25 minutes left, so we're not going to have everyone answer every question, but you can raise your hand. We haven't had, this is the first in the history of Zoom, we haven't had anyone trying to speak who is on mute. So that's great. We do have a few questions. Here we go. The first one, what can nonprofit organizations that previously received non-COVID related funding, which I think every organization probably is in that same boat, what can they expect from foundation support funding in the future? What have foundations learned about the needs of nonprofits to be able to support the communities they serve? And I'll put a third part in there. Do you anticipate changes in grant making overall? So if Mike, you want to take a quick stab at part of that, and then we'll move around the room, anyone that wants to.
Yeah, I think that every community and every funder's response is going to be a little different. As I mentioned, for us in Dayton, we've pivoted 100% of our discretionary grant making this year to some significant efforts and initiatives we have around race and equity, around the long-term tornado recovery, and about long-term issues related to COVID. That is really tough. And when I look through the questions, this kind of ties into some of the other ones. If you're an arts organization or a museum or something that maybe isn't perceived or necessarily plays right in those lanes, that's going to be tough. And honestly, I don't have a good response for that. I really don't. I understand it. I really do. I used to run the YMCA, so I get it. I absolutely understand it. But I think there's those are the challenges I think we take, and how do we leverage our philanthropic dollars to fill those gaps? The reality is, I think, Dale, you alluded to it, is the reality is on COVID, the heavy lifting is absolutely being done by the public sector, right? So federal money flowing through, state money flowing through, counties, and really philanthropy is what's that gap money, how can we leverage ours to pull down other funds? And I think that's the best way we're going to be of service. It'll all come back. It'll all come back, right? There's a bright light at the end of the tunnel. It's just going to be bumpy for a while.
Yeah, I'd like to just add to that and say that in our last grant round pre-COVID, we moved our discretionary grant making to focus on capacity building. And, you know, in retrospect, it was a very smart move for us to do that. I know as a former nonprofit leader, those are the most important grants that we had that allowed me to kind of allocate them where we needed and to make investments in infrastructure. And many of those were technology investments that we've gotten a ton of feedback on the importance of doing that, which allowed for nonprofits that weren't in a position to go remote and to adjust programs to be virtual. They had a head start on that. We're likely to stay in that space. And then issues of race and equity cut across everything that we're talking about. And so we will be more exacting there for sure. And then lastly, we have reduced the barrier to applications, and we have taken in video submissions as a way to save time, or applications that they've submitted to other grant funders so that they do not have to do additional work in a time where time is precious.
I like that last one. I'm going to have to think about that one. You know, we have tried to be frank, to do a both and. We did pivot those first few months after COVID to, like a lot of foundations, change project-based to general operating. We relaxed reporting requirements. We actually stepped up our regular TCF, Cleveland Foundation, grant making to every 2 weeks, which was a lot for the staff. And we are planning to continue to try to do a both and. Yes, not everybody is making it through. We are trying really hard, like Chanda said, to focus on those groups that need capacity building to get them through COVID. Do you need a development director because you didn't have one and now you really need one? Some of our groups did different things around the arts because, to be frank, the arts is Cleveland. Let's be clear. The arts in Cleveland is about economic development. And so not funding art was not an option for us. We had to figure out a way to do something. We couldn't do probably as much as people would want, but we could not do it because we just could not do that. So to be frank, we're trying to figure out a both and. I tell people you should still call us. We may not say yes as often as we did in the past, but it is not a definite no if it's not COVID related, because we understand that there's many people still hurting. It may not be directly COVID related, but in the end, if it's housing or food or police related, it all ends up being COVID related. And so we're trying as much as possible. This year, our board has said, keep going. No one has told us to stop yet. So far, we tell people to call us and let us know, and we'll walk you through. If we can't support in 2020, because the budget has been very tight in 2020, maybe we can get you in 2021.
Chanda, since you're so gracious to join us here in Ohio, I'm going to put the next question just to you so we can get to more. Help us understand here in Ohio, both our foundations and our nonprofit communities, how can they, the staff, the volunteers, educate the board on issues related to COVID and the racial inequities it has underscored? So,
Yeah,
and I ask you because you're not a executive director, you're on the front lines.
Yeah, I mean, yeah, so I feel like we're all on the front lines at this point, but I what I will say is that, and the question was, how do we educate the board?
Yeah.
Is that it? I think that there's a commitment and there's an opportunity, and, part of, I think, educating the board and your staff is a recognition that we don't have the answers. And I think that has been a challenge, is that we want to step in because people look to us. Our position has been that we're on a journey with our staff, with our board, with our community, and we are making investments and opportunities for people to learn, which is, again, where the podcasts come in and other things that we have deployed as a recognition that that proximity is necessary for us to make the best decisions. Race and equity is central to everything, and it gets demonstrated through issues like COVID and George Floyd. These are things that have been there all along, and I think it's important that we make certain that people understand that this is not episodic, and then there's the issue of race. That the issue of race has been undergirding all of these things, and it's time for us to examine it, to be in the work, and to think about how we need to pivot ourselves in our understanding of the issues.
Well, to build off that, I'll go to a question that came in via chat as well. So what is the role of foundations, of philanthropy, when it relates to the conversation around disinvestment or defunding the police?
Yeah, I mean, we're squarely in that conversation, and I think, again, that our role in philanthropy, or how I see my role in philanthropy in the community foundation that I represent, is that we have a role in helping our community get to the best place of reimagining public safety that does not put community members at a disadvantage, where we're not over policing, where we are not seeing brown and black people get killed by the police without consequence. And so by framing it to public safety and what does that look like, we stand a little bit away from the semantics of what is happening, because I think we agree that we need to have responses that are consistent with the needs of communities, so that we don't have police responding to mental health issues, that being poor and kind to poverty, or not being over policed, and we have a proper infrastructure. I would suggest that that has been our role all along, but that we're now seeing the intersectionality of these issues and have a responsibility then to respond to that. But yes, we're in it, but I would say it's not about the police. It's about how do we make sure that community is safe and protected and gets what they need from our policing department.
Dale, Mike, any quick follow-up to?
Well, I'll just say that for the Cleveland Foundation, we funded over the years a number of different initiatives, organizations, programs that focus on some aspect of policing or criminal justice reform over the years. Have we had one particular strategy? No. We're feeling the need to get back in. And one thing we just did, thanks to the Fowler Family Foundation and a few others, the Ratners, we're just hosting the Bail Project for the first time in Cleveland. but it's really them who brought it here. We're very proud to be a partner with them, but we're not leading in this issue, so that we can help people who don't need to stay in jail can get out, because the data shows that they don't skip their court appearances. They usually are, responsible citizens, and they don't need to be staying in jail unnecessarily. So things like that, I know we're trying to do more of, where we feel like we can make a difference, whether it's just holding the funds, we're collecting, that's a donation, a donor advised fund. People can give to that to support that. We're trying to think of things like that. And then we're trying to figure out, kind of like Chanda, where are there spaces where maybe we could lead a little bit more? So to be frank, we're figuring that out over the next few months and following groups like Chanda's, the Minneapolis Foundation, to see what they do, so that we can see where we should fit in.
Thank you. Mike mentioned, and Dale, everyone referenced it, the new partnerships that have developed, whether it's the county, city, regional planning commission, or other foundations that you're engaged with in different ways. How does this change your outlook on the future partnering with like-minded organizations, whether they're philanthropic or your nonprofit partners, or if they're governmental agencies, knowing that, as was said by Dale, philanthropy money she said a drop in the ocean. I like drop in Lake Erie, but how does this change your work moving forward with internal and external partners in philanthropy?
Well,
Mike?
I'll just start. It changes it a lot. Let me be clear. I mean, yes, we had partnerships in the past, absolutely. And still, with those partnerships and those various collaborations, to be frank, many foundations think we can solve problems on our own. And this proved in many ways, shape, or form that we cannot, period. And so it's not a question of will we go forward together? It is a question of how will we go forward together? And that's still to be determined in some instances. We figured it out around the COVID fund how to do that. There are a bunch of other projects that are going to be in the works, going to be announced in the next few days, few months. Other collaboratives focused on other aspects of this issue. They're all going to be slightly different. The one thing I want to say is that even just the term partner needs to be thought about differently. Because when we said partner in the past, we meant other philanthropic partners. When we say partner going forward, we don't just mean that. We mean our government entities, we mean our community residents, we mean neighborhood groups. We want to expand what we mean by partner. Because to be frank, the lived experience is just as important as whatever expertise we bring to this. And we've got to figure out a way as a philanthropic community to figure out a consistent way to bring that voice into the conversation, not a one-off focus group. That will not solve the problem. We have to figure out how to share our power, to communicate in different ways and communicate consistently over long periods of time so that we are not the ones thinking that we have all the answers. Because to be frank, in COVID, what became clear to philanthropy is that we don't. We are not the only ones with the answers. We have to work together to figure out this new normal.
Anyone else on that question? Partnerships moving forward, how they changed, how you sustain them?
As Dale mentioned, I think everybody on this call, everybody gets America, a nonprofit, a funder, everybody collaborates. I think it's a matter of degree and scale. And when you start to think about systemic racism or a pandemic or tornadoes or whatever, I mean, when you get into the scale of some of these issues, we've got to make the investments. We've got to invest in the infrastructure that's going to be persistent and just keep coming at it, persistent. So for us, it's going to be very different from community to community. For us in the greater Dayton area, for the last 20 years, what I'll say is we have programs related to race and equity, and you have a plan, you get a program, you get funding, you execute the plan, you move on to the next one. But we really quickly recognized, Chanda, you mentioned this, that race is at the core of so many of the issues that we're dealing with, and we recognize that we have to have a more systemic way to come together, not as a city, not as a county, but as a region to deal with systemic racism. So about 18 months ago, we laid the groundwork for what's now emerging is what we're calling the Institute for Livable and Equitable Communities. And in a nutshell, it's a regional way in which we can come together to work on our most persistent and troublesome problems. Every community is going to be different. And for the Dayton area, we think having people that get up every day that are committed to this is one step, that we've got a permanent, deliberate, persistent way to think about this and to work on these issues.
Yeah, I just want to add to that, and I think those types of efforts are cropping up and evolving from the last effort and the last table and the last partnership table that was looking to address an issue. And I don't want to discount that, but I also want to reinforce that the work that we're doing at our foundation is equally as internal as it is external. That there's a recognition that we have been complicit in some ways with the problem, and therefore we have a responsibility of looking at how we have been part of that. What actions do we need to take? Do our staff feel heard and part of the solution? Are we looking at impact in the same way as we're looking at donor services? And so our commitment is really about evolving our organization so that we can involve what comes from our organization, from our foundation. And so we are not distancing ourselves from what needs to happen. We see ourselves in partnership and in recognition that something has to change.
Mike, you mentioned the 8,000 donations that came in a short period of time, and I assume in Minneapolis and Cleveland Foundation and nonprofit organizations around our community that are addressing the needs, there's new money coming in, maybe not, maybe it's small donations from individuals. How does Minneapolis Foundation plan to continue to engage with those new donors? How's the other side of the shop operating, basically, in reaching out or listening when phone calls come in?
Yeah, I think that there's a couple of things that have happened in the wake of George Floyd. One is that we have Black-led organizations that have been receiving money at a larger percentage than what they have in the past. And so those dollars have gone directly into those organizations. And we're seeing both support and scrutiny. So how can we support them with the capacity that they need to respond if they so choose us to be part of that conversation? So that's one element of it. I think the other one is that because of the visibility and the concern and just the pure shock for many on the issue of COVID and watching that 8 minutes, almost 9 minutes, 8 minutes and 46 seconds of George Floyd, we have donors that have been leaning in a much different way on both of those issues and being more activated on their own. So we have the capacity to try to respond to that with a great deal of intentionality and strategy. I think what we need to work on is how do we keep them engaged in this long term? How do we develop mechanisms for them to stay in the learning and stay in the giving and stay in the investment with us? And we are thinking through that as we speak. And so we haven't necessarily had a challenge of getting people to lean in and give resources, but along with resources, I think they are trying to more deeply understand, how did we get here? How did we get here? What did we learn? And how should I be thinking about future giving? And I think that's the opportunity of the moment.
Yeah, I would agree with Chanda that, you know, it's easy for us on the program team side because we talk a lot about where our dollars should go and why and all of that. On the advancement side, where we're recruiting individual donors, first of all, our program team doesn't control that. People have been leaning in. I mean, I was amazed. I never thought we would get to the amount we got to for the COVID fund. And we got there partly because of the individual donations. They came in droves in ways that we did not think were going to happen, to be honest. And we're seeing that again. We're going to start to see it, we're sure, on the racial justice stuff. But the issue, like Chanda says, is how do you keep them involved? How do we spend a lot of time on the program staff training ourselves, getting to know the latest issues. What do we need to know more of? How do we do that with our individual donors? Because what they're saying to us is they want to know more. And how are we doing that? And I think that's something we're going to be thinking about going forward.
You know, in addition to those are all great points. as I think about that from a little different perspective, having had multiple issues in 1 year, I think the answer to that's it depends. John is the answer, because if you take like the tornado funds, most of those donors came from Dayton or what I'll call Southwest Ohio. You looked at the shooting funds, Dayton and Southwest Ohio stepped up, but also came from all around the country and all around the world. And I mean, the reality is I'm not going to spend much time with them. I mean, that's just the facts of it. And then COVID is 100% local, right? So for us, it'll be a different response to each of those different situations.
All right. This is the last question, and it's a one word. Mike, it depends is 2, so this will be a one word. Someone is trying to organize a group to address systematic racism in their community. Learn together, learn individually, or come together after learning individually. Together, individually, and then coming together.
Latter.
Dale?
The latter. I think we all have our own individual journeys to take, and we have to come together to learn together. So we have to do both.
I say yes to all.
Mike?
I'm going with Dale.
Okay. Thank you. Thank you to our panel for sharing about your work. Chanda, Dale, Mike, Deborah, and the ways that your organizations and communities are responding and providing those examples of how philanthropy and community organization can focus on the work in the future. And thank you to all of you in our virtual audience for joining. Wherever you are zooming in from, you can be a philanthropist. Your communities and local community organizations need you. They need your time and your treasure, your talent. If you have a passion or vision and want to take action, connect, there are organizations working on the front lines, working with philanthropy, working with individuals, working with nonprofits. With that, we'll conclude our hour together. Thank you all for joining. Be well, be safe, and be kind. Good afternoon.